Hello, and welcome to Step into VR Simulation, a nurse-led guide to implementation. I'm Maggie Major, a fellow nurse simulation enthusiast and your guide on this adventure. This is part one of our 5-part mini-series designed to help you launch and grow your virtual reality nursing lab. By the end of this series, you'll not only understand how VR simulation can transform your program, but you'll also have a practical roadmap to make VR happen at your institution. Each bite-sized episode will walk you step by step through designing, launching, and expanding a VR simulation program. Throughout the sessions, you will be completing activities in the Step into VR Simulation, a nurse-led guide to implementation workbook. If you have not already done so, please download the workbook now. In this video, you'll gain a clear snapshot of VR in nursing education, identify the gaps and opportunities unique to your program, learn how to use a structured needs assessment to start your VR journey, and complete a readiness reflection activity in your workbook. Let's start with the basics. What is VR simulation? Virtual reality simulation uses immersive technology. Think headsets and hand controllers that let learners step into lifelike clinical scenarios. They can practice essential skills, respond in real time to changing patient conditions, and make mistakes in a safe, low-stress environment. No real patients or mannequins required. We know that nurse educators face real challenges, such as limited clinical placements, faculty shortages, and a growing demand for experiential learning. VR simulation is more than just high-tech hype. It delivers engaging and repeatable simulations in a safe learning environment. Imagine a student, Mia, who lacked maternity clinical experiences. With VR, she could assess OB patients, manage emergencies, and repeat skills as needed. That gap closed. Open your workbook to Activity 1, Reflection on your current state. Write down your 3 biggest clinical or curricular pain points. Where do your learners repeatedly struggle? Where do you wish you had more experiential opportunities, like pediatrics or mental health? Pause if needed to complete the activity. VR isn't meant to completely replace traditional simulation or the clinical site. It complements both. Studies have shown that VR enhances clinical judgment and critical thinking. It allows unlimited practice attempts, anytime, anywhere. It standardizes scenarios while reducing faculty prep time. It supports diverse learning styles and makes data and competency tracking easier. Before you dive into new technology, take a pause. Too often, institutions jump into a new technology without first understanding where it best fits. You'll want to gather data and perspectives before building your case for VR simulation. Open your workbook to Activity 2, VR Needs Assessment. This step will help you to highlight gaps in the curriculum, such as where clinical placements or traditional simulation are lacking. Identify the learner and educational challenges, and document technology and resource strengths and barriers. For example, if your learners repeatedly lack experience with deteriorating patient scenarios, you may flag that as a curriculum gap. You might also note feedback from learners. Maybe you have heard a learner say, "I wish I had more time to practice assessments." Or maybe a nurse educator has stated, "We struggle to schedule enough sim sessions." You're not just capturing what's missing, you're pinpointing where VR will make a difference and setting the foundation for a strong program proposal. The final step for today is aligning your gaps with program and accreditation goals. Does your program need to improve pass rates, prepare for new competency standards, or offer equitable learning to remote sites? Use the workbook's reflection prompts to match your gaps with measurable goals. For example, Increase medical surgical self confidence scores by 10% after VR integration. You've just completed the most crucial and often the most overlooked step, understanding your program's unique needs and opportunities. Keep your insights handy because our next episode is about building your VR foundation, including budgeting, stakeholder buy in, and drafting your VR vision. If this episode sparked ideas or you had any aha moments, I encourage you to write them in your workbook and share them with your team. See you in part 2, Building the Foundation for VR.